first and also touch on the Affordable Care Act. I've worked in healthcare for almost 28 years and I've seen the importance of being insured. Everyone thinks something will happen to them, but inevitably it will, and it can affect you for the remainder of your life. I know everyone here is probably thinking insurance, what a boring topic, but it's very relevant to all age groups. Some of you have a pre-existing condition such as asthma, or you may have a family, or you may be on the other end of the spectrum and going to be a SVIA grad who might want a job. It's argued that a portion of the young adults, 3% of them in fact, will have incomes that are too high to qualify for federal assistance with this program. But this group of people will still benefit from the healthcare exchanges. They can still get prescription coverage, medical coverage, but mental health care or maternity care. And this coverage will remain in effect no matter even as you age and as long as you become ill, it still is in effect. The Affordable Care Act is something we're all going to have to live with, and being an informed consumer can save you time, money, and open up possibly a new career. On October 1st, the healthcare exchanges a portion of the Affordable Care Act will come into effect. This rolling out of the healthcare exchanges, which is an electronic market where people can shop for and compare insurance programs and check their eligibility for either Medicaid or public aid programs such as CHIP, which is the Children's Health Insurance Program. It was just announced this afternoon by Health and Human Services Secretary Kathleen Sebelius. In Indiana, the insurance plans in the coming federal health insurance exchanges are expected to run from just under $100 a month for single adults to close to $1,000 for a family of 4. A 27-year-old Hoosier will pay anywhere from about $168 for the bare bones catastrophic policy to $332 for the cheapest of the gold standards. You also can qualify for federal tax credits to reduce this cost if you qualify. Some facts that you might want to think about are young adults aged 19 to 34 are the group least likely to be insured. That state, 47% of these are Latinos and 33% of the African American population. The vast majority of uninsured say they do this because they can't afford it. The Affordable Care Act also allows people under age 26 to stay on their parents' insurance policy regardless of if you're in school or not. And starting in 2012, health insurance plans aren't allowed to deny you coverage based on a pre-existing condition. This is a great benefit. In the past, they could deny you coverage if you had asthma, a heart condition, or even a pre-existing knee injury. You're not required to use a health exchange if you have other insurance, which through your employer or through your family. If you do the federal exchange, you can get federal subsidies, which are income-based, to help you pay for this. If you choose not to get the health insurance and not to be on the exchange, you will have to pay a fine at the end of the year on your tax. They tack it onto your taxes. It's $95 an adult, or 1% of your family's income. It's important to be informed on the health insurance exchanges and the benefits you're entitled to in the Affordable Care Act. Probably doesn't seem like such a big deal to have insurance when you're younger, but an injury such as a knee injury can have huge financial burdens. Here's an example. A woman had her ACL repaired in Florida in 2012. Her hospital charge was $32,000, and her portion of the insurance was $1,600 with $1,800. Can you see the benefits of the insurance there? An appendectomy would be covered by insurance, and it can typically cost between $10,000 and $35,000. If you have insurance, it's about $100 copay, and then your 10 to 20%. As you can see, these conditions can occur at any time, and it's very important to have health insurance coverage. I urge you to check out the information on the health insurance exchanges and become an informed consumer. The marketplace simplifies your search. You can compare plans based on price, benefits, and important benefits, being the features you want, which allows you to make an informed choice. Like I said, starting next Tuesday, October 1st, the healthcare exchange market will open. Indiana's exchange is part of the federal exchange. The new laws will offer healthcare coverage at a reasonable cost for most consumers. It's mandated that every citizen be covered either by insurance or public aid. Those who choose not to do it will be taxed in the end. As I've stated before, we have no control over some healthcare issues we face, but it's essential we have healthcare coverage so that our health issues don't become burdensome financial issues as well. Most bankruptcies in this country are caused due to medical bills and illness. Also, I urge you to check out potential jobs in the healthcare market. Some of these include customer care specialist, health insurance exchange navigator jobs. Also, United Healthcare and QBE North America are several companies hiring in our area. Thank you, and I hope you learned a little bit today.